Hi, this is Dr. Frezza at the Chiropractic and Injury Center. Today we're going to be talking about disc conditions. Take a look at our chart here. We're looking at this woman from the side, and the way we're looking at her, there are three curves that matter. If there's a curve in her neck that looks like a reverse C, there's one in her low back that looks like a reverse C, and then the one in the middle goes in the other direction. And if you think about it, it kind of forms a spring, right? The head is heavy, the torso is heavy, so you want that springiness or that give so that the weight of the body gets distributed, okay? We have the vertebral segments, right, which are the bony segments, but then in between each of the vertebrae are the disc spaces, all right? The discs are important. They do two things primarily. The first thing that they do is they act as a placeholder, right, or a cushion. You want them in between each of the vertebrae, right? So we see a vertebra and a disc, a vertebra and a disc. You want those discs to be nice and thick so that the two vertebrae are spaced properly, okay? So that's the first thing that we want the discs to do, to act as a placeholder. The second thing is probably a little bit more important. Again, if you look at this chart, in the neck we see these blue dots here, and in the low back we see these mustard colored dots here. Now, it can also happen in the mid back, but we see mostly in the neck and the low back. If you follow these blue dots, they form something called your brachial plexus, okay? And what happens is there are nerves that come through these holes and they go out into the shoulder, down the arm, and into the fingertips, okay? In the low back, if we come back over here, we see the mustard colored dots, all right? They come through, they go into the hip, into the buttock, down the leg, and into the feet, all right? So it's very important that these discs are nice and thick because there are holes that these nerves come through. So when the disc is thick, the hole that the nerve comes through is unimpinged. So you have a vertebra, you have a disc, and you have a vertebra, okay? And that's what keeps these holes open so that these nerves can go through unimpinged. But what we see with disc injury is the disc is beginning to thin, okay? We usually see what's called a herniation, okay, or a bulge, all right? Regardless of which one it is, what happens is as the disc begins to thin, the hole that the nerve comes through begins to shrink. And as the nerve shrinks, then as the hole shrinks, the nerve gets pinched. When the nerve gets pinched, that's when the person can come in with symptoms down the arms, symptoms down the legs, or just pain in the neck and low back, the area that the disc is injured, okay? We see that quite a bit. Again, we usually see it with injury, slips and falls, car accidents, lifting injuries, those sorts of things. There are particular things that we want to do from a chiropractic standpoint once we find out the extent of the damage, right? Things that we want to do to see if we can go in and correct or repair it. So if you think that you may have a disc injury, again, you're welcome to come into the office. Let us do a consultation. Let us do an exam. Let us take some film. Let us see exactly what's going on, where the area of injury is at, and then we can come up with the appropriate treatment protocol based on the individual findings. All right? This is Dr. Frezza from the Chiropractic Injury Center. Thanks for watching.